On December 31st, 2019, a novel coronavirus was first detected. This was the start of the COVID-19 pandemic. This event changed the lives of everyone, a change intensely felt by our healthcare workers and professionals. Join me, Ryan Funk, as we sit down with Manitoba-based frontline workers, immunization specialists, doctors, and nurses with diverse backgrounds to share their stories, experiences, and contributions during the pandemic in Canada. So today I have Sylvia with me. Thank you for joining me, Sylvia.
Thank you for having me.
Perfect. How about we just start with a little bit about your position, currently what you're doing and what you were doing prior to everything falling apart during the pandemic.
Sure. So currently my position right now is communicable disease and immunization team manager for the central team for the Winnipeg Regional Health Authority, which I'm central. So that's for the public health unit for our region. And I guess during COVID, I was a public health nurse and I was doing my normal activities up until we got our first case. And when I had to work on call, kind of just went a little downhill from there. I ended up working with the first case with the contacts, and I had a very busy weekend with manifests from airplanes and from the boat cruises that were landing in Canada, or not landing, but disembarking in Canada. And it just was history from there. Like, it became a blur.
And you have a very interesting perspective because you were a nurse at the beginning of it, but you also transitioned to a leadership role throughout. So having your perspective is great because we can get an idea of what it was like for the nurses on the ground and then for our leadership places and getting that information, kind of coordinating everything. Because, there's not a textbook on what to deal with a pandemic. It's something that happens very rarely. I guess in the span of human existence, 100 years is not that much.
Yeah.
But for most of us, we haven't lived through something like this before.
Well, you know what? I joined public health because we are about promotion, protection, and prevention. So one of the main goals of public health is if we deal with communicable diseases. So if there's an outbreak, you're on stand and you work, right? You get it done and you protect people. So, we've always anticipated that there might be some kind of outbreak that we would need to be part of, just like H1N1. It was kind of almost a test for us for this big conversion of COVID. But I think that mentality just prepared us. But when you get into the actual pandemic version, it's beyond compare, actually. Like it's mass, like it's the staffing, it's the criteria, it's the working hours, it's the long hours, it's working as a public health nurse, it was difficult. All my colleagues had a difficult time. We were doing case and contact. So we were the ones phoning. We would get the results from the cases from the lab, and we would be contacting people, educating them. Of course, people weren't always happy to receive a call from us, right? Because then we're telling them to stay home. We're telling them not to go to work. If they're at work, we're asking them to go home. So it's hard telling a single parent, hey, you actually have to go home and isolate. There's different reasons why families struggle. So it was hard to be on that end as well. Moving from there, I became a communicable disease coordinator. So it was just kind of transitioned as I was being involved with COVID, and as COVID responsibilities grew, my position ended up shifting as well, and I became a communicable disease coordinator. I was then in charge of the focused immunization team, so responsible for the immunizations for the personal care homes and those clinics that existed all throughout Winnipeg at the malls or at the schools that you saw. So it was a team that we had created to do that. So and then from there you transition, and I continued to grow, and I became very interested in management, and that's where then I stepped into the communicable disease and immunization manager. So
when you're on the ground in the trenches as a nurse during that period of time, we're seeing the case numbers skyrocket during those early periods. Like in Manitoba, it felt like we're in a bubble at first where everything started affecting outside, and it slowly closed in, and some people are like, nah, this is going to pass over us. But unfortunately, it did hit us. For you and your colleagues, what were some of those early days like, and as we were going through the nitty and gritty before the vaccine? Being
the first week and kind of where a lot of things and activity was happening, where we started to see, we were phoning in and telling people to isolate. There was even a large conference happening in Vancouver. So we actually had to contact some of those people from the conference because we were informed that there were possible cases. So it was really busy that first weekend. after that weekend happened, they created a team called the Centralized COVID Team. So I volunteered to be part of that team, and we shifted to work downtown. And working on that team, that's when we started to have the cases. We started with 20, ended up having 30 one day. And then all of a sudden, then there was 40, 50, then it was 200, 400. And then it became unimaginable, the numbers, and it became so much. And our teams had to grow. So, and they were long hours. It wasn't something that would just 4:30, we're going to go home. Cases still
just
came
clock
in.
off. We're done for the day.
No. Cases kept coming in. We had an obligation. I felt an obligation that I was there to protect and prevent. So I felt, I think all nurses kind of feel that obligation that you're there for the health of and well-being of everybody. So you work, you're going to get the work done. There were times I would leave at 10 at night. And I know my colleagues, they did as well.
Thank you from myself for just the work you went through, because I know personally I'm not strong enough to do that. People are way stronger than me in terms of handling this sort of crisis situation, the crunch, the going through, because it was scary. There wasn't a lot of information in those early days.
Yeah, I mean, we started with a very simple document. We had a 12-page document, kind of gave us guidance of what we had to educate families about. That document grew from 12 to 34. All of a sudden, it was over 124 pages. So, and the information changed so quickly from even morning to afternoon. Sometimes there would be something different. And, it was a lot of reading and rereading and then rediscussions.
Well, that was the biggest challenge, because just how science work, we're always updating our information on things. Like, well, this is the decision we made based on the information we had then. Well, then things adjust. So we've learned more. Well, now we have to change our perspective on things, which I guess was a challenge for a portion of the population that felt it was just confusing. Like, why you keep changing your message in that? And during that period of time, it was just so easy with social media for misinformation to spread during that time. And I guess just from a leadership perspective, what was those experiences around the table, getting the information? And then you have the public being like, no, we actually know better. Well, I should say a small percentage of the public.
You're always going to have those differences. So we worked within our teams. We had communication. We had a medical officer of health who would huddle with us and give us information. We had a great group, great team. The province would give the information to the medical officer of health, and then that would be passed on to us or through a manager. So as I progressed through my career going to communicable disease, then I was able to sit at certain tables. So I was able to sit at some of the immunization tables with the province. So then I got to see how the information is shared and how we disseminate the information, how we practice what our changes are going to be. So I think, I was so caught up with the science. I was involved and entrenched. I never had time to search other media avenues to get all that information. I would hear my friends say things and I'd be like, well, that's not true. Where did you hear this? Like, are you finding out your facts? Are you sure?
I read a Facebook headline, so now I'm an expert.
Yeah, exactly. So it was a lot of discussions through Teams meeting with my friends and things like that when they would have questions. But
it can be frustrating sometimes, because I have friends who work in science and then family members that are anti-science.
Yep.
And the frustration that can have when you're trying to be like, no. This. It can be a challenge. And for our nurses, I guess just what was the experience and reaction from the public, or at least your perception of the public's relationship to nurses during that time? Because just from my perspective, at the beginning, it seemed like everyone was like pro nurses. Hey, let's go out, let's get them lunches, get them cookies and things. And then it felt there was a moment where everyone was really starting to get exhausted during the pandemic, mentally and physically, that, at least from my perspective, there seemed to be a shift in how people were treating nurses, or like their perception of nurses. I guess just what are your thoughts on that, and did you notice stuff like that at all?
Can't say that it didn't go unnoticed. So, I never felt like a hero, even though, we'd had that at the very start. Oh, you're the heroes. Like, well, you know what? No, we're trying to get through this together, right? I think where it shift, I guess there was a shift. And I think where people became upset, like we would be phoning people cold and saying, hi, my name is Sylvia. I'm a public health nurse. I'm here to contact you. You've been in contact with someone with COVID. Imagine getting a call like that. You don't know. You weren't informed that people were going to be calling you. So I think we got some people were distrusting. They didn't like us. We did have some vulgar language used towards us, right? So it was just different perspectives. I guess it changed, and people probably didn't trust us anymore, and it was hard to gain the public's trust. But I was more behind the scenes on a phone. I was protected. I can't speak for the nurses and my colleagues in the hospitals, right? It's a different perspective, and I'm not sure what they went through, but I can imagine.
That's a challenge through a situation like this, because people were frustrated. Our nurses everyone was frustrated after a certain point, because it feels like it just went on forever, 3 years. But man, those were the longest 3 years ever. There was that moment when we finally had the vaccine. Did that feel like a shift, almost like a sigh of relief, okay, now we can start moving forward?
Absolutely. I think we were on edge right until we knew that a vaccine was coming. As soon as we were able to, I actually was privileged. I attended the first clinic because I was working it with my colleagues, but we were doing the healthcare providers at Max Rady Center. It was an emotional day. Seeing that first immunization going into that first person, I'm sure there were many tears of joy. I also got to experience the first personal care home resident being immunized, and again, tears of joy, right? Because you're just finally some relief. Maybe we're going to see it change. We're going to see we're going to see protection. We're going to protect more people. It was very emotional. And then it's disheartening when people have that other view where they, the distrust, or they don't think it's good, or, why are you forcing this on us? And it's just a different perspective, right? I come from healthcare, and I'm trying to help people, and it's a challenge. It is
frustrating, because I know for myself, when you're trying to have conversations with people and you're like, yeah, the vaccine, you got the vaccine, you're just a sheep sort of thing. And it's like, well, what do you want me to do? Should I not trust our health professionals in place and just listen to some pseudoscience online? It's frustrating. And I mean, this goes beyond just the pandemic, but everything that's happened over the past couple of years has kind of been a little bit of a boiling pot towards all of culture recently. So I guess that's a challenge and a frustration that we're seeing, unfortunately.
Yeah, it's so funny, because we were so it was such a big change, I think, overall, not even just in healthcare, that everyone was so united, and then all of a sudden this division. So it's quite sad to think back how that transpired.
Well, hopefully eventually we'll kind of see a pivot back, and we can work again, because politics and things right now,
keep it separate. Yeah,
keep it separate. What do you think are some things we can learn from what happened? Maybe some of the stumbling blocks that we saw within our systems, this was a great thing that we had in place, and what can we just learn moving forward? Because, we never know what's going to happen, so we might as well be prepared.
I guess being prepared. I think we don't know what the next 100-year pandemic will bring. We presume it'll be similar, but maybe not. We don't know. And by then, most of us will probably have passed on. But workforce, that would be key to any pandemic, is getting that workforce as quickly as possible, and everybody up and running and up to speed, because we had to reach beyond the nursing means for immunization. We reached out to other counterparts and had other professionals helping with us. So there's no way we would have been able to immunize the amount of people we did in the amount of time we had. So, thank you to everybody who helped and supported us. I appreciate everybody. Everybody's a hero in my eyes. So.
Well, of course, everyone was instrumental in making this. Everyone who had to go out to work, like our frontline workers, delivery people, our healthcare professionals, everyone, getting us through this awful moment. Yeah.
And that brings me peace, because everybody was in it. Like you said, it was a delivery person, it was the cashier, it was just so many people involved in it. It was even like if I had a repair person coming, the questions over the phone, making sure that we're safe so that they could come in and do the repair. Everybody was in it. It was just, it was definitely an emotional last 3 years.
At least for myself, it's about that community and working together, because we're only going to be able to move forward and deal with things and continue to build out of this if we work together, if we know our neighbors, we celebrate with them, we come together. That's the only way we're going to figure things out.
Yep, totally agree, 100%. Unity, yep.
Awesome. Well, thank you so much, Sylvia, for taking the time to share your perspective with us.
Thank you very much.
This project is funded by the Government of Canada through Canadian Heritage.